Tanairy here. Welcome to the workshop on wellness and coping skills. And it is recording. All right, so my screen. Let's share. Okay. All right, so I'm sharing my screen. So all should be good. All right. So this is the first I'm presenting virtually. So please excuse my slowness. So that's just something I wanted to mention before starting. Full disclosure, there is some anxiety there within me, just because I've never presented virtually. So I've never presented on a Zoom platform, WebEx, none of that. It's always been in person. So this is my first. So I just want to put that out there. So since I'm feeling a little tension, right? Let's start off with just being able to be aware of that. So that's what I'm doing. I'm being aware of the fact that I'm feeling some anxiety and I'm expressing that to all of you. But I'm also giving that to myself as well. So I'm just going to kind of like roll my shoulders a little, get some movement going, and I got this, right? All is good. All will, will happen. So today, yes, we're going to focus on wellness and coping skills. So I'm going to try to introduce some skills either that you may not be aware of or that you may have heard before, and just kind of give you a little bit more of an understanding of what to do in situations where you may be more anxious, more irritable, and also a little bit more on the depressed side. So I want to start off with this quote, the world as we have created it. Ooh, what was that? The world as we have created it is a process of our thinking. It cannot be changed without changing our thinking. And that's from Albert Einstein. So I want you to think about that a little bit as we go into our presentation today. Current changes. We cannot talk about mental health and wellness if we do not address the current changes our world and has been going through during the past couple of months. So the past 4 to 5 months have been extremely intrusive inside our worlds, personally, also externally. So we need to know that all these changes that are listed in here have impacted us in one way or another, or have impacted someone that we know of. And as a result of that, that can have a huge impact on our mental health. And when I say mental health, I'm addressing our function within our brain and how certain chemicals change in reference to our external environment. So current changes, COVID-19. Did anyone know about COVID last year? No. So this is totally new for everyone. And this came as a total shock. And this came very aggressively within the world, not just the United States, but the whole world. So whenever we hear COVID-19, right away, it's a trigger for us. So we got to keep that in mind. What has COVID done to us and our families and our communities and our environment? School and work. What has happened with school and work? It's totally different. You know, this is something that's affecting many individuals because either A, if you're a parent, you're used to dropping off your son or daughter to school, then you go back home either to do what you have to do and you have the time for yourself, or you go to work. So it's either the child goes to school, you go to work, and all is good, right? Or, you know, you're an individual who you are used to your routine where you wake up in the morning or in the afternoon, whatever it may be for your time wise, you go to work, you go into your office, you go into your working environment, and then you're able to check out and leave. Now everything was integrated into the home. So now we have parents with their children in the home. Now we have individuals with spouses who may not be the most supportive within their home. And this has caused a lot of chaos within individuals, just because the structure of what we're used to is totally different and we're cooped up within our own homes. Quarantine. This is a total opposite of what mental health providers recommend for anyone who's going through depression and anxiety. We always recommend exposure, going out, being able to socialize, being able to put yourself outside of your usual norm. And with quarantine, we can't do that. We are stuck stuck in our own little four walls or whatever it may be. So the chances are that the rates of depression do go up and anxiety does go up. And that is just going to happen because you're cooped up in an environment where you can't leave and explore and be physically active. So that is something we have to look at, is quarantine, how that has affected us. Black Lives Matters. That is huge. This is something that we've been talking about for years and years and years and decades. However, during current circumstances, it has risen very high. And this is something that's great that, more awareness is happening. But this is causing anxiety within the community. Because if you are a person of color, you're really in it right now and saying, am I supposed to be worried that, if I have a child of color, that they're going to go through this? When is this going to end? And we have all this anxiety builds up and this fear based. So even though there's great things happening with the movement, there's still a lot of fear within individuals. So that's something that's currently happening, and that is something we need to be aware of as well. Mental health increasing. We know this. This is not something new. Mental health is on the rise because of all these changes and all these adaptations that we have had to have these recent times. So we need to keep that into account. And I want us to be mindful of that during the presentation, is when we discuss mental health specifically. Laid off. We know this very well, that this is a time where many people have been laid off. Many people don't even know when they're going back to work. There's a lot of industries that can't open yet. So they've been gone and out of work for a very long time, which has caused a lot of difficulties within themselves and others. Food and home supplies. This is something we never thought that we would go into supermarkets, see empty shelves. That is what we all went through not too long ago. We walk into a store in fear. Am I going to find something there? Am I going to find what I need? And today, some families still struggle with that financially. Can they leave and get something from the supermarket? No, because they don't have the money to do so. So when we were all in it, where we were all struggling to get that toilet paper, paper towel, right, and chicken, it wasn't there. Now, it may be there, but some families are still struggling to make it there because they can't afford it. Media. This is something that has triggered all of us. So we need to be very mindful on what we're tuning into and being able to tune out. The media is on steroids when it comes to the Black Lives Matter, when it comes to COVID-19 and all those issues. They're just they're on repeat over and over and over. And I want us to just sit and be able to think, what does that do to our brain? What does that do to our eyes? So we need to be able to tune out and check out. So when I say tune out and check out, what I mean is visually tune out, right? And then mentally check out, because we can't be there. We can't be in that world all day, every day. It is not going to help us in any way. Loss and grief. We can't talk about changes without loss and grief. There has been a lot of loss within the country and within the world. And that means that a lot of people have been experiencing grief. A lot of people have been experiencing a life without someone who was there at one point, and how maybe it was due to COVID or something else. But there's a lot of that going on. And loss, a lot of people have lost stuff during this pandemic and continue to lose things. And that's something we can't not address. So this here is just a picture of a recent study that was done by Kaysher Family Foundation, which shows what is the major negative impacts and the also minor negative impacts within individuals who were sheltering in place compared to those who are not sheltering in place. So as you can see, being in quarantine and cooped up inside does not do well with our mental health. It actually makes symptoms much more negative and major, which means that the symptoms are more severe. And then you also notice that those who are not sheltering in place, the symptoms are less. It doesn't mean that it's not there. It's there, but it's less than those who are inside. So I just want to give you some stats. Since we're focusing on families as a whole, I did want to address children. And these are some statistics to be aware of when it comes to mental health. 50% of mental health starts at the age of 14. We need to look at that. If more than half of our population, or more than that, is struggling, mentally, and this is our children, our vulnerable population, we need to keep that in mind. 1 in 5 children would have a mental health diagnosis sometime in their life. Suicide is the second leading cause of death among children ages 10 to 17. And if you're an African American child, ages of 5 to 12 are dying by suicide at nearly twice the rate of their white counterparts. 10 years, let me just move this here. 10 years is the average delay from onset of symptoms and date of treatment. I'm going to repeat that. 10 years is the average delay from onset of symptoms and date of treatment. That means if I'm a 14-year-old adolescent right now, I am not going to seek treatment until I'm 24. That is 10 years of no treatment but struggling with mental health. The rates are so low among our younger counterparts to seek treatment, and that needs to change. So we need to be mindful of that as well, is that if I know someone or I am someone, either a young adult or a child, and I'm struggling, I need to get treatment sooner rather than later. So for adults, mental health conditions are common, affecting 1 in 5. Do you see a trend there with children and adults? Both 1 in 5. So 1 in 5 people do have issues with a mental health condition. Increased use of psychiatric medication without psychotherapy. There has been a big trend within the past couple of years, or the past 10 years, that people go to their primary care doctor, say, I'm feeling anxious, I'm feeling a little low. And what happens? Their primary care doctor says, okay, take this medication. But there is no therapy to substitute that. So what we know with research is that therapy with medication together is the most successful outcome. Medication alone is not as successful. So there's a big trend of people just getting the medication thinking that is the most effective, but we also need to be able to include the other part, which is the counseling component of it. Young adults are less likely to seek treatment compared to older adults. So that's what we showed before. The younger generation is not seeking that treatment for whatever reason that may be, insurance, feeling the stigma. But as people get older, they tend to go into treatment. 1 in 7 women would get a perinatal mood and anxiety disorder. So this is mostly known through the generation as postpartum depression during the first 3 months after delivering. However, the rates increase to 1 in 5 after 6 months postpartum. That shows us that when a woman is giving birth and is after delivery, the chances are high the first 3 months, but they get even higher after 6 months. 1 in 10 men get postpartum depression. Surprised? Don't be, because men do experience this after having a baby. Well, the woman having the baby mostly, in most cases. If their partner already has a perinatal mood and anxiety disorder, the rates go up to 1 in 5. So I want that to sink in a little bit, because our culture and our media outlets always focus on how it impacts the woman, but we also need to know that it also impacts the men in their lives as well. Even a happy life cannot be without a measure of darkness. And the word happy will lose its meaning if it were not balanced by sadness. And that is by Carl Jung. So what are we looking for when we're looking at our wellness? We're looking at our whole mental health. There are many things we have to look at. I just want you to be aware and know that this is not predict a diagnosis. I just was very general in this slide, just to give you an idea of what we're looking for, either within yourselves, within a child, within someone you know that may be struggling. There are 4 things we're looking at. We're looking at changes in mood, changes in behavior, duration and frequency, and also impacting social work or educational functioning. So what does that mean? That means that when we have something going on in our lives, it's not just happening once in a while, it's happening very frequently and it's more intense than ever before. So I always tell clients all the time that we have all these emotions. So what's in that box when it comes to mood, we all experience this at some time in our life or sometime throughout the month, right? So we need to know that these moods and these emotions and these feelings are normal. However, we have to look at the frequency and the duration. How often does it happen and the severity of it? So we're allowed to be angry, we're allowed to be irritable, we're allowed to be anxious, we're allowed to be sad, we're allowed to be happy. All those things we are allowed to have because it's part of our human nature. But if it starts affecting our school, it starts affecting our work environment and our social interactions, then that's when we know there's something more going on. And the changes in our behavior is a huge one. So if you're someone who's always very active, extroverted, and all of a sudden you notice, like, no, I need to stay away, I need to remove myself from that social situation, then you know something is different and something is going on. If you're someone who was very active in, let's say, working out, and you all of a sudden decide, no, it's not for me anymore, I'd rather just be on the couch watching TV, that's a change in your behavior. So we need to see that there's a change and there's a shift. Very commonly, when someone is going through something, there may be certain increases or decreases in something. So sleep, eating, weight gain, weight loss. Sleep is a very big factor when it comes to our mental health. So just know that we're looking at mood. So it could be anxiety, worry, irritable, sad, feeling empty, hopeless, worthless, and changes in behavior. And then also, how often is it happening? But first, some meditation. So obviously this is a presentation on, being able to be more mindful within ourselves, learning coping skills and strategies. So we cannot present without practicing, right? So something from Gandhi, an ounce of practice is worth 1,000 words. That is what we need to implement. We are not perfect, we're human. So we need to be mindful that, hey, if I just do a little bit every day, that is more than enough, and accepting that and being able to validate that what I do is good enough. But if we don't do anything, then nothing is going to happen. So it's just doing a little bit of that practice every day or a couple of times during the day to help us mentally and physically throughout our days and weeks. So what I want you to do is I just want you to get into a comfortable position. Okay, I'm just going to pull up my little guide here. Okay, so I'm going to be using my little music bowl here. So when you hear the noise, that's what that is. So I just want you to find some comfort, find a place where you feel comfortable just to sit or lay, but just know that we don't want you falling asleep, right? I'm still here. Okay, so find a comfortable position, but one in which you will not fall asleep. Sitting on the floor with your legs crossed is a good position to try. Close your eyes softly or glaze into something in the room. Roll your shoulders forward and slowly back. Lean your head from side to side, lowering your left ear towards your left shoulder, and then your right ear towards your right shoulder. Relax your muscles. Your body will continue to relax as you meditate. Observe your breathing. Notice how your breath flows in and out. Make no effort to change your breathing in any way. Simply notice how your body breathes. Your body knows how much air it needs. Sit quietly, seeing in your mind's eyes your breath flowing gently in and out of your body. Your attention that may be wandering, but don't dwell on them. Simply let the thoughts pass. See how your breath continues to flow deeply and calmly. Notice the stages of the complete breath, from the in-breath to the pause that follows the exhale, and the pause before taking a breath. See the slight breaks between each breath. Feel the air entering through your nose. Picture the breath flowing through the cavities in your sinuses, then down to your lungs. As thoughts intrude, allow them to pass and return your attention to breathing. See the air inside your body after you inhale, filling your body gently. Notice how the space inside your lungs becomes smaller after you exhale and the air leaves your body. Feel your chest and stomach gently rise and fall with each breath. Exhale 1. Inhale 1. Exhale. Continue to count each inhale and exhale as 1. When we're breathing, we want to be able to breathe in through our nose and feel our belly expand through our belly. And when we breathe out through our mouth, we want to feel the air coming out slowly and our stomach going back in. Notice how your body feels. See how calm and gentle your breathing is and how relaxed your body feels. Now it is time to gently reawaken your body and mind. Keeping your eyes closed, notice the sounds around you. Feel the floor beneath you. Feel your clothes against your body. Wiggle your fingers and toes. Shrug your shoulders. Open your eyes. Remain seated. Straighten your legs and stretch your arms. Sit for a few moments more, relaxing. And I want you to take that in. That was just a quick meditation, just to be present with your breath and being present in the moment. I don't think I can see if there's any questions yet. No. But feel free to ask any questions along the way and we'll address them as best as we can. So let me continue with that. Coping strategies. So now we're back. We got our body flowing. We got a little bit of that meditation. Now I want to throw you a bunch of stuff, but don't overwhelm yourself. This is all just a little bit. Whenever we work with clients, we like to focus on the 5 senses because within coping strategies, we want to be able to know that we have all the senses in one, and that's one way of being very mindful. So we want to be able to look at a couple of things. So we're looking at our sight, our hearing, our smell, our taste, and our touch. So I like to incorporate all those things in any strategy that I have, because when we are anxious, we lose a lot of those senses. We forget to hear, we forget to touch, we forget to smell and taste, and that is what causes us to be within that panic and within that fear. And what we want to do is be able to express that out. We want to be able to say, wait, what am I feeling right now? What am I touching right now? What am I seeing? What am I hearing? All those things are very good factors. So the reason I use the bell is because that does something to our brain that triggers us to listen to it. So I'm going to do it one more time. And I want you to just listen to the tone as it enters and leaves, okay? If you just sit in an environment and hear that, that brings you to the center of your focus in that moment. So little things like that can be very good for us. So mindfulness is the first category I put. So guided meditation is just what we did. I guided you in a meditation. It was short, it was quick, but I don't want to spend too much time on it just because I want to leave time for questions for everyone. But guided meditations are so helpful. They're very good with routine. Anything I put on here is very good to do either as a morning routine, afternoon, or night. We need something within our mind and our body to wake us up, to go peacefully to sleep, or to keep us energized in the afternoon. So I want you to think of all these and say, how can I maybe incorporate some of these into my lifestyle? Grounding yourself in the present moment using the five senses. That's what I just mentioned. We want those five senses. We want to be aware of them. We want to see them. We want to feel them because that is what's going to keep us grounded in that moment. So if we're having a panic attack, that is what's going to keep us grounded and decrease the amount of that panic attack or remove it completely from us. Journaling, that's a huge one. Journaling is so great. I recommend it to my children, clients, adolescents, and adults because it's so good to just let out the thoughts. There's days and there's times we don't want to talk to anyone. We don't want to say anything, and putting it down on paper can be so relieving, and it can also be very relaxing at the same time. So some of the ones I like is Zen as F. Not going to use the word. I don't know who's watching or who's listening. That's a very good one. It tends to be more focused on women, like the colors and the language. So usually I tend to recommend those more from my female clients, but anyone can use them. Start where you are. That's another very good one. And that one, could go either way. Gratitude journal for men. That's a good one for my men clients that I tend to recommend. Deep breathing. That was something we did during the guided meditation is feeling that breath, breathing in through your nose deeply until you can't anymore, and then breathing it all out of your mouth until you can't anymore. And slowly is the best way. Deep breathing is very good and it's shown to be very effective if you're going through a panic attack or anxiety or worry. Before my presentation, what was I doing? I was deep breathing. Yeah, you heard me. I was deep breathing. Because, sometimes we just get anxious. It's a normal feeling. And I think the more we accept it, the less it becomes a fear. So I think that's something that we all need to start getting used to is that when I'm anxious, not a big deal. It's part of my emotion. It's just a very extreme form. It's expanded. We can't give it so much attention. And that's what we do because our brain right away goes to that. Our mind just says, hey, let me feed off of this. Let me feed off of your fear. But we got to be like, no, no, no. I'm not going to let you feed off of my fear. I have control. I'm going to ground myself and I'm going to do the best that I can to let this anxiety easily flow away. Tools. I love tools. Anyone who comes into my office sees tools everywhere they look. I have it all over my office because they're so helpful. If it's an aroma diffuser, I always have that in the back going. Maybe you can see it, maybe right here. I always have it going, even within my own home, I have it going as well. Essential oils are very good. I listed an amount there of many different essential oils. And then Rose Cortez facial massager. So I brought it here to show you guys. I love this thing. This is my new tool that I use before going to sleep because it just relaxes my muscles. Sometimes we hold a lot of tension in our face, and something as simple as this can be so relieving and relaxing. But my favorite one is the vibration one. So this is just a roller, and the vibration, you see it has like a little tip there. When you turn it on and you put it under your eye, it connects to those sensors within your face and your muscles and release and actually melts away those muscles. So that could be a very helpful tool for someone who holds a lot of tension in their face. I'll sometimes use the vibration right here and my pressure point right in my third eye right here. And that relieves a lot of tension as well. So for teas is a big one. Research, has been growing recently in this area and has been showing that there's a lot of teas out there that tend to be very beneficial to our mental health. So one of them being, let's see what I put on here. Green tea, kava, and passion fruit, and passion flower has been very big recently on improving sleep. GABA has been very big on just relieving anxiety. Green tea has been shown to decrease symptoms within anxiety and even depressive symptoms. So look into your teas, look into them and see which one is a good fit for you. And obviously speak to your medical provider before doing any of this, because obviously I am not a MD, a doctor who's prescribing or who's saying to do what, but it's good to look into it. Let's see what else we have here. So physical practice, yoga. We want to be able to physically feel ourselves in that present moment when we are tense or we are anxious. Exercising is also very good if you're into cardio, running, walking, Zumba. A lot of people culturally tend to be very big on dance. So if you are one of those individuals that culturally, dance is a big part and music is a big part of your life, incorporate that into your exercise and make it fun. Dance is a big one. A lot of people love dance. That's how they relate. That's how they express themselves, is through dance. Find the opportunity to do that, even though you may not have the space. Be in your four little corners and just, do the dance moves that you like and express yourself. Washing the dishes and cleaning and movement. Research has been showing that if you are just washing your dishes and feeling the water in your hands and feeling the soap as you are washing the plate, sometimes that can be very mindful and soothing as well. Progressive muscle relaxation. That's a great one. That's something you are presently in your mind, you're being mindful, but you're targeting all the muscles in your body, starting from your toes all the way up to your face, or you can do it vice versa, starting your face all the way down to your toes. Audio, music. Music is so big. Just this morning, I had a conversation with my counselor in training, and I told her that one of the biggest things I miss during this quarantine is that just getting in the car early in the morning and driving to work and putting my music on blast and just being in the music, feeling the music, hearing the lyrics and just singing along. That is what would wake me up in the morning. And that's what increased my energy in the morning. So if you're someone that likes that, is how can I find ways to incorporate it even though I'm still at home? Calming nature sounds, that's a good one, in the sense of that sometimes we just want to lay down, read a book, or we're just laying and we don't really know what to do. Just put some sound in the background, something calming, if it's either the beach waves or the air, trees and leaves, whatever you like, to kind of just be in that moment with the music. Hearing your positive affirmations out loud. This is one worth to try. So saying something like, I believe in myself. I got this. I said that earlier in my presentation, if you heard me. I said, I can do this. I got this. I can do it, because that gives me power to say that I believe in myself. But if we don't say it out loud, we don't hear it, sometimes we may not believe it. So try to say something right now. I want you to say a positive affirmation out loud to yourself. If you have people around you, it does not matter. Say something like, I can do this. I am capable. I love myself. Those things can encourage self-growth within. Daily habits. We want to focus on sleep. Sleep is huge. This is something that has been a big work of research recently, is being able to have effective sleep, have restful sleep. So it's not that you're just sleeping and then you wake up. It's being restful sleep, where you sleep and you can say, wow, I feel great. I had a good sleep. That means if you don't feel that or you don't think that, that may mean that you're going to sleep a little anxious, on edge, worried, and those things need to be addressed in order to have a restful sleep. Nutrition, that's a huge one. What we put in our bodies is who we are. We hear this all the time. I don't have to tell you, but it's how do we have a balanced diet? Of course, we're going to go and have, Shake Shack and have some, a cheeseburger with fries, right? But as long as that's not your everyday routine, accept it. But overall, try to be balanced, try to have that nutrition in there one way or another. If you're not one who likes to eat actual vegetables, juice it, if you're someone who doesn't like it cooked, eat it raw. If you don't like it raw, eat it cooked. So find ways on how can you incorporate those nutrients into your body, because it's going to affect your mind in a very positive way. Water, we want to hydrate. This is something, for some people may be a little bit more difficult than others, but drinking water is key. We want to be hydrated. We want to make sure that we have those fluids in our body. So we're going to end with this quote. You have brains in your head, you have feet in your shoes. You can steer yourself any direction you choose. You're on your own, you know what you know, and you are the one who'll decide where to go. Of course, that's Mr. Dr. Seuss, All the Places You'll Go. Such a great book. So I want to leave you off with that quote. And the last slide is just focusing on referral sources. If you are thinking that you or someone you may know may be struggling with something mentally, even if you may not know, you may feel like, oh, I just feel off, or I feel like my son is just not being himself, contact a professional. There's no harm in that. So right here, you have the information on Balance. So that's the office of where I work. And, we mostly specialize in children and adults with anxiety and depressive disorders. We mainly see children with anxiety disorders. So that could be social anxiety, generalized, separation anxiety, OCD. And then we also specialize in working with moms through pregnancy and postpartum with any anxiety and depression they may be experiencing. We also have other clinicians in the office who do a lot of trauma work, who do a lot of adjustment to life changes. And then I also put resources there for postpartum. If you know of any mom or any family members who may be struggling, or dads, that's a good resource. Malloy College Mental Health and Wellness Center, they have a outpatient clinic that is for the community, and their rates for mental health services are low. So that's a very good resource. And currently they have a lot of groups running virtually that can be either free or at low cost. And then the Office of Mental Health Emotional Support Helpline is a very good resource if you're just looking for referrals, or you just need someone to talk to just about COVID and how this has been affecting you emotionally. That's a very good resource as well. So I want to open up the floor to some questions, because I want to make sure that I answer everything, or any questions you may have. So let me just X myself out. Let me stop sharing for a second. Okay, I'm here. How can I know if you guys are here? I feel like I'm talking to myself, and this is not cool. I'm so used to people being in front of me and me seeing the engagement. I can't see if you're engaged. I can't see if you're looking at the TV. So please help me, be present with you. Throw me a question, a comment, or something, so I know that you guys are here and that you guys are listening. And I'm not talking to myself. So that's mostly it. Carolina, so I don't know if you want to get in to make sure that you heard everything I said, and to make sure that this is still going.
Hi, Tanairy. That was great. Thank you so much. I know the engagement piece is so tough because you can't see everyone, and it's hard to interact, but I'm sure everyone had a great time listening to you, and thank you so much for your tips. I actually would like to get us started with a question of my own, if that's okay.
Yeah, go for it.
So I know that we talk a lot about feeling overwhelmed during these times, but what are some helpful tips when you feel underwhelmed? I know that sometimes I feel overwhelmed by being underwhelmed, if that makes sense. I actually said that to my supervisor a couple of days ago. There's so much to do, and sometimes your energy is so low. So what are some little tips that maybe can help you get that spark going again and keep you motivated to get going?
Okay, so let me see if I hear the question right. So are you saying that it's more feeling like underwhelmed, where it's just like, well, not a big issue, the world is fine, kind of very nonchalant? Or is it that you feel lack of motivation?
I think it's a little bit of both sometimes.
A little bit of both, yeah. So usually we tend to see that a lot in the younger adult population. A lot of the time, it's just a sense of I don't know what to do. I really don't have the motivation, but I'm kind of okay with what I'm doing, and we kind of do the minimum. So what I usually recommend for people to do in those situations is to find something you find engaging, something that kind of lifts your energy. So that's why I mentioned dance and music as a big one, because that's a big one for a lot of people. But something that just kind of gets you moving, even if that is working out, or if that is listening to your favorite playlist, or talking to a friend who always hypes up your energy. That is what we're looking for, because when we are low and we're kind of blah, we need something to engage us in that moment. So you may not feel the motivation to say, hey, I want to turn on my radio, or hey, I want to call this friend, but that self-talk is very important. So saying like, even though I don't feel engaged, let me see what happens if I call Cindy. Let me see what happens if I just put on my music, but I'll just sit here. The chances are you'll feel something, you'll notice something, and it may trigger something positive within you that can lead to the increasing of motivation. So that is one thing I would definitely recommend.
Thank you so much. And it's always great to have a personal hype woman, right? Or hype man.
Yes,
It's
that
always
is
so much
true.
fun.
Yes. So
I'm
I can't
seeing,
see if there's any questions on here.
so I'm actually seeing that Bernadette and Irene both have questions. So
Okay.
Bernadette, I'm actually going to take you off of mute so that you can ask your question. Only I learn how to do that. Give me 1
I think I
second.
could do it. Let me
You
see.
can? Great.
Unmute. Yes. There you go. Bernadette?
I guess my biggest question was, how do you, like, during this time with all of this change, like, do you have any suggestions on how to stop, like, overthinking some of the
Mhm.
negative stuff that's out there?
Yeah, so we tend to call that intrusive thoughts a lot of times when we have these racing thoughts that just go, 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 go. It's very common for individuals right now because there is so much going on, but we have these thoughts that easily intrude us right away. But it's like I mentioned about the anxiety, it's not pushing it away, it's not saying go away, go away, go away. It's accepting it, listen to it. So if you're having a thought of like, oh my gosh, am I going to get sick? Is my family going to get sick now that we're going out? And that thought constantly rumors in your head is saying, okay, let me see what evidence do I have in front of me that shows that I'm going to get sick. I've been very clean. We've been very cautious of keeping the 6 feet distance. So giving yourself evidence to make you feel a little bit better. Because obviously we can't predict the future. We don't know what's going to happen. So we have to accept our present moment. So when our mind wanders, we need to accept that that is going to happen automatically without us wanting it or not wanting it. So we need to accept that part. But then the second part is, how do I address it? How do I address these negative thoughts? How do I address these intrusive thoughts? And being accepting of it. So accept that you're having them, accept that they exist, but now what do we do with them? So I always tell people to use positive self-talk. So saying something like, I'm going through a lot right now, but things will get better. I know things will get better. My history has shown me that I have been in tough situations before and have gotten through them just fine. I'm in another tough situation right now. I will get through this again. You may feel good at that moment or a couple of hours after, but it may come back again. That intrusive thought will come back. And that's when we say, okay, let me work on this again. And when we notice it happens very often, that's when we recommend going to counseling and just speaking to a professional about it. Because when it becomes very invasive in our life where we can't function, we can't concentrate that well, that's when we need someone to kind of guide us through it and help us through those difficult thoughts that we're currently having. I don't know if I answered your question.
You did.
Okay. Okay.
Thank you so much.
You're welcome. Let me unmute you. Okay. Okay. You said there was another question on there. I don't know. I can't see them for some reason.
I see Irene has a question as well. Irene, I'm not sure if you posted yours on the Q&A box or if you'd like to come off mute. Just let us know so that we can remove you. But her question is, what is postpartum anxiety? I think that my daughter experienced that. It was very scary.
Say it again. What was postpartum what?
What is postpartum anxiety? I think that my daughter experienced that and it was very scary. I'm just reading what was on the Q&A box.
Okay. I don't know if she wants to get off of mute so she can explain the question a little bit more. I don't know if you mean postpartum anxiety, in reference to after having a baby. Is that what you meant? I want to make sure I understand the question before I answer it. She raised her hand. Okay, so let me unmute you. Irene?
Yes.
Hi, thank you. So is that the question you had on postpartum anxiety after having a baby? Hello?
Not hearing me.
I hear you slightly.
Oh,
Yes, I hear you now.
okay. So yes, my daughter experienced this after a baby, and it
Okay.
was very, very frightening.
Yes.
She was I don't know, it was like a out of control kind of a thing,
Mm-hmm.
and out of nowhere,
Yes.
nothing she had ever experienced before.
Yes. So you want to know more on what is postpartum anxiety?
Right, because really, we never heard of that. We only heard
No.
of depression.
Yeah, see, thank you for that question. I love that you brought that up because that's why I said when I mentioned perinatal mood and anxiety disorder, I said people tend to know it as postpartum depression, right?
Right.
But there's so many other layers to it. There's postpartum OCD, there's postpartum anxiety, and the very small population, but it does exist, 1%, is postpartum psychosis. And
Oh,
usually,
my.
and usually in the media, we always hear about the postpartum psychosis or the depression, but very rarely do we hear of the anxiety, which honestly, the anxiety is so much more higher in the population of women postpartum because, they have all these fears related to, am I doing this right? What's wrong with my baby? Why is my baby crying? I'm a bad mom. I don't know how to put my baby to sleep. There's so many thoughts that happen that causes the woman to have this big ball of anxiety
Right.
that is very difficult. So thank you for bringing up that question.
And it was a first baby too, so
Yes.
there were a lot of questions.
Yes. So we do notice that counseling is very helpful with those with that population of women because they just need a space to know that what they're thinking is normal. And
Mhm.
sometimes, they need a second opinion to know if what they're going through needs extra medical attention. So if your daughter hasn't gotten any help yet, I would recommend that she does speak with someone because it does relieve a lot of the anxiety for sure.
Well, thank you for that information.
Yes.
Actually, she did end up
Good.
having some therapy, which worked.
Good.
And the baby, I'm babysitting right now, so
Ah!
you might hear that
Yes.
in the background.
Yes.
But at any rate, I'm nervous because she's just told us that she's expecting again. And what are the chances of this happening to her again?
Good job, Irene. You got the questions on point. That's good. So what we want in those cases is to have all the supports in place. So she wants to have her therapist in place. She wants to let her OBGYN know that she went through postpartum anxiety and having that checked. As long as she has her medical team there,
Right.
she's good to go. That is all we recommend is that if she has them all in place, she is good. What happens is that when moms stop treatment, either if it's medication or a therapy, and have another baby, she's at very high risk. But if she is continuing the treatments that they recommended and she has her team there, she is good to go.
Okay.
Yeah.
Thank you so much.
Good
I
job. You're
appreciate
welcome,
it.
Irene. Good
Okay.
questions.
Thank
Yeah.
you.
Okay. Is there anyone else? I can't tell.
Tanairy, I also believe that Rita has a question.
Rita. Okay, so I'll unmute her. Rita? Can you hear me?
Yeah, can you hear me?
Yes. Yeah, go for it. What's your question?
Questions. My husband's here also. So one is, it's very overwhelming about like the different titles of professionals because there's counselors and then there's
Yes.
therapists and there's psychotherapists.
Yes.
I mean, there's like 10 million different things.
Yes.
So I think that can be overwhelming. I'm not really sure that I have a question, but it's just like a thought that it's like, if you want to go talk to somebody, it's like, I don't even know where to begin sometimes because
Yes. That is so true. And thank you for bringing up that very important question because that is what everyone thinks of. Either you have the person who has no idea what the title means and is like, just give me anyone. I just want to talk to someone. Or you're that person kind of like yourself that's like, okay, I have all these titles in front of this person, but I don't know what they mean or who to go to. So usually what I tell families is that you need a social worker, a licensed mental health counselor, or a psychologist if you're looking for individual counseling, right? However, if you're looking for something more broad, like family therapy, couples counseling, that may be more the realm of, let's say, like a licensed clinical social worker or a licensed marriage and family therapist. If you're looking more for testing, let's say you have a child who struggles with ADHD, or you don't know if they're on the spectrum, or they just have a lot of behavioral issues, you may be looking more for a psychologist who does testing more specifically neuropsychologists. When it comes to medication, we're looking at a psychiatrist who's an MD or a psychiatric nurse practitioner who is like an NP. So those are prescribing providers. But if you're just looking for, I just need someone to get into counseling with, there's three of them. There's licensed mental counselor, which is someone like myself, licensed clinical social worker, or a clinical psychologist. And they all have different areas of specialization. So what I tell families is to focus on what you're really looking for and see if they specialize in that area. So when you go to, let's say, a website like Psychology Today, anyone could post on there that they specialize in everything, right? But you want to specifically know, like, okay, what training do you have in, let's say, if your child has anxiety disorder, what experience do you have in anxiety disorders? And see that they're specifically talking about that in their profile. If they do, then they may be a good match. So it's being able to not look so much at the title and the letters behind their name, but more what certifications do they have and what areas of specializations do they have, and does that align with what you're looking for? Does that answer your question?
I think that's a lot of good information.
Yeah. Yes, but it is overwhelming. It definitely is. It's a big field, and I'm happy to see that there are many providers out there. But we always want to make sure that you're being matched with a provider who is who's trained in what you're looking for specifically.
Right. And then my husband had a question.
Yeah, go for it.
I know that you mentioned the teas and stuff like that.
Yes.
Are there any, like, types of food that you would suggest avoiding, like caffeine related, like for like anxiety, like anything like, that you would avoid?
Yeah, caffeine is a big one. Coffee, those coffee drinkers, right? Even though you love your coffee, it's not that great. Sugared soda is not good. Processed foods, like these are all things we hear every day, right? Processed foods, things with sugar, things that are out of the box. Those are things we don't want. We want things straight out of the ground that go into the table. So that is fruits and vegetables. If you like fish, go for fish. If you like meat, be careful with the kind of meat that you buy. So I always tell clients that balancing is the key, because the last thing I want is to tell you, oh yeah, you need to get into a balanced diet, vegetables and fruits, and then just stop doing everything else that you did. That's going to affect you because you're like, no, but I really want this cupcake. I really want this cupcake. And then you become anxious and worried about that. So it's like, how can you have that cupcake, but then overall throughout your whole day, you were pretty healthy overall? That is always my philosophy, is that when it comes to mental health, is incorporating good nutrients in a balanced diet. So making sure you have your blueberries, your antioxidants, making sure you have your greens in there. And the reason I stress blending it and doing a smoothie or juicing is because not everybody is that's not their palate, so it's good to drink it, because that way, if you drink these nutrients, it may be easier for you to put it in your body. I am definitely one of those people, where if you put a salad in front of me, I'll probably eat half of it. But if you give me a juice, I'll drink the whole thing. So it's just being able to say, how do I balance my diet as best as I can?
Thank you.
You're welcome. Any other questions? Can you see if there's any other questions on there or no?
I don't see any additional questions. So if we don't have any, Tanairy, thank you so much
You're
for your time
welcome.
and for this wonderful presentation. This was so wonderful.
Good.
I really appreciate you sharing your advice, expertise, tips with us.
Mhm.
Always so helpful, and such a pleasure to have you and to meet you.
Same
And
here.
this recording will actually be available on our virtual events library, so it can be referenced at any point moving forward. I'll be sure to share that with you personally,
Great.
as well as the attendees. And if anyone wants to reach you, would you mind just retyping your contact information on the chat bar?
Oh, yeah.
So people
So
can
all
take a look.
participants.
You got it. And in the meantime, if there's any additional questions, we're still here for a couple more minutes. Thank you, Tanairy.
And then I'll just put my email just in case.
And folks, feel free to screenshot that or take a picture.
Yeah, so feel free to contact me if you have any questions. I know it's very hard when we talk about wellness and coping skills and finding a good match when it comes to resources. So I'll be more than happy to guide you towards something or something that you may need.
Thanks again, Tanairy. And I'll let
You're
you have the
welcome.
final word before we check out.
Thank you all. It was such a pleasure to have this beautiful afternoon with all of you. I'm sure you were eager to be outside, and now you can go out and enjoy your day, and I will do the same. And I hope to speak with you all again one day.
Thanks again, Tanairy. Bye,
Bye.
everyone.
Bye-bye.